Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. The Invos monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on the utility of Invos system. What are the principles of NIRS oximetry? To help answer this question is Dr. Ronald Bronicki, Professor of Pediatrics at Baylor College of Medicine, Section of Critical Care Medicine and Cardiology at Texas Children's Hospital.
NIRS oximetry, like pulse oximetry, is based on the principles of spectrophotometry. On the left is the prototype pulse oximeter, which was produced in the mid-1970s. On the right, the prototype NIRS oximeter, which was produced in 1982. The evolution that each type of monitor has undergone is quite remarkable. Today, pulse oximetry is considered by many to be the fifth vital sign. NIRS oximeters, like pulse oximeters, rely on the application of the Beer-Lambert law. The Beer-Lambert law enables us to measure the concentration of a substance, in this case oxygenated and deoxygenated hemoglobin moieties, in a medium, in this case tissue, based on hemoglobin's absorption characteristics. The Beer-Lambert law considers light intensity and light detected to determine light absorbance. It relies on a known distance traveled by the light, that is to say, the path length of light, and the absorption coefficient of the chromophore, which depends on the wavelength of the light and oxygenation status. At least 2 wavelengths of light are needed to measure the concentration of chromophores. Near-infrared light with wavelengths between 700 and 850 nanometers are used because the absorption spectra of oxygenated and deoxygenated hemoglobin are maximally separated. Modification of the Beer-Lambert law is necessary to assess the concentration of hemoglobin because of tissue-induced light scatter. As depicted in this figure, light scattering results in variation in the path length of light and the loss of some light which is neither absorbed nor detected by the light detector. The modified Beer-Lambert law relies on the correction factors to account for the impact of scatter. This cartoon depicts the Invos oximeter probe. The probe has a LED on one end that emits near-infrared light. The near-infrared light is used because it is able to penetrate bone and in doing so assess tissue oxygenation in the underlying brain parenchyma, 1 cubic centimeter of tissue, some 2 to 3 centimeters beneath the probe. 2 photodetectors at separate distances differentiate the signal arising from superficial tissues, in this case the soft tissue of the scalp, and deeper tissues, in this case, frontal lobe, the signal that we are interested in. This technology is referred to as spatial resolution. NIRS oximetry measures the absorption of light by hemoglobin moieties in the entire tissue field, subtracting the pulsatile signal. The signal is processed and a mean oxygen saturation is generated. Because the majority of blood by volume is venous, some 75 to 80%, the saturation is viewed as a surrogate for the venous oxygen saturation of that viscera. The proprietary algorithm which processes the signal relies on several assumptions. The scatter-induced variations in light path length and light loss are not overcome by incorporating the correction factors. Furthermore, spatial resolution does not completely eliminate contamination of the signal by superficial tissue, and the proprietary algorithms rely on the assumed proportion of arterial and venous blood in the tissue field. For these reasons, there is inter-subject variation in readings. NIRS oximeters measure changes in hemoglobin concentrations from an arbitrary baseline. Studies have demonstrated that NIRS oximetry readings closely track changes in regional venous oxygen saturations. For these reasons, NIRS oximetry is approved by the FDA as a trend monitor. Although approved as a trend monitor, multiple studies have shown that cerebral oxygen saturations approximate jugular and SVC saturations. This study demonstrates a strong correlation between cerebral and jugular oxygen saturations.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.